Yes, you will, I'm sure, had. Good. Into. Good. Good. All right, Adrian, so what brings you in?
My upper back, I guess, would be the main thing.
Okay.
Just the fact that I've been in car accidents and I sprained my back when I was younger.
Yep.
I have chronic pain even though I'm young, so it comes and it goes, and I'd rather it just be good all the time rather than bad days more than good days. I'd rather be like, oh, damn, today's a bad day.
Yeah. Okay. Any specific movements, activities that seem to aggravate the issues?
Anything bending over.
Bending
so
over.
even just sitting like this, I'm like, I gotta sit up straight, or in like 5 seconds, I start to hurt.
In that upper back?
Yeah, like
Okay.
right in the center.
All right. And any other issues anywhere else?
Just random lower back pain, but
Okay.
other than that, no.
Okay. Cool. All right, let's take a look at your posture. All right, you can see pelvis is shifted to the right. Now step off and step back on it for me.
All right.
And, yep, right back there, in there, good. Yeah. Yeah, so you're, okay, you can come on out. So your pelvis is going to the right.
Okay.
So essentially you're like this, and your upper back is actually pretty centered, but your pelvis is off to the right. It's causing you to carry about 10, 12 pounds more on the right side of your body. And I think the kind of the low back and the upper back going in basically different directions is creating a lot of tension up here.
That would make sense.
So we got to unkink the head and neck, bring this pelvis back under you, and that will release a lot of that pressure and tension in the upper back. Go on your back for me. When was the first time you had, when did you sprain the back?
I sprained it in 8th grade, so
Okay.
like 2010.
All right.
And then I've been going to the chiropractor since I was young for like my ankles being flat or my feet being flat.
Mm-hmm. Okay. All right. Maybe slide up the table just a little bit, Adrian. Other way,
Oh.
towards your head. Sorry. There you go, right there, right there. Okay. So your left leg is shorter than the right by about a 1/4 inch. It's not really shorter, it's contracted. So when the body goes out of alignment, head and neck kinks, basically what happens is pressure on the brainstem, the body kinks, and it causes almost always one leg to basically pull up or kink, contract.
Mm-hmm.
And for you, it's the left leg.
Okay.
So what we want to see, obviously we want to hear that you're feeling better from you, but what we want to see objectively is we want to see these legs balanced.
Mm-hmm.
We want to see you standing centered, and then we want to see x-rays that show the head and neck are basically 90 degrees balanced. When we have all that, you're in alignment, and that's what we call, then it's holding. If you come in again and again like that, we'll do other things to release tension in the area back, and we'll probably do a little cold laser and things to help the tissues heal. But that holding in alignment is what allows the healing to take place.
So like staying with good posture.
Well, yeah, good posture is important, but you can't actively, your body's out of alignment, and you can't force it into alignment by standing up centered. You're still going to be crooked. But once you're in alignment, yeah, good posture and all those things are definitely important. It will help you stay in alignment too better. If you go out and you're like this, you know, your body's probably going to collapse and go back out of alignment.
Yeah.
So I'm going to have you sit up facing this way. In here, I can put your, I can put your glasses on the chair for you because you're going to want to, Adrian, you're going to come lay over here on the right side, actually, right side of your body. So your shoulder here, head there, ear's going to go in the slide. And slide up just a little bit. So this is the new code of the upper cervical adjustment correction. So we're going to come 1/4 inch low and 1/2 inch anterior. Then we push through the tissue onto that top bone in the neck, the atlas. We hold a light sustained pressure at the angle we get from the x-rays. And if you get all 3 measurements right, the blocking of the head, the rotation, and the height, your head and neck will basically just slowly shift back into alignment. And I can feel the resistance or the tension of the misalignment, and you can kind of feel it breaking or dissolving, disappearing, and I just keep pushing until I don't feel anything anymore. Is it okay on your ear? Or does it hurt? All right. We're almost done. Okay. Come on up. And slide down and lay on your back. Okay, sit up for me and then just sit up nice and straight. Do you feel, and you may not, do you feel any different right away?
I feel like you did something here.
Yeah, okay. So, and then just come around. I just want you to take a few steps across the room and see, it kind of lets the body reset. Then we'll adjust everything else. And do you feel anything?
I feel like I'm going like this with my head, but
yeah.
She told me that my head was tilted.
Exactly, and sometimes you feel like you're leaning the other way.
Yeah.
Cool. Well, let's check you standing again and see. Sometimes it takes, you got to rest for a little bit before the posture changes, and sometimes it's right away. But yeah, it's funny. Sometimes you feel like you're leaning the other way for a while. Yeah, that's way better, actually. Really good response. Yeah, you're only about 5 pounds difference now. Pelvis is centered. Really good, Adrian. Okay, so now we're going to go look to specifically face down, release tension at different points of the body. So go face down.
All right. Wait, right here?
Yep. Lift your...
Where do you have my arms? Here?
Yeah, that works. That's fine. Lift your right leg straight up and down, and the left and down. One easier than the other?
No.
Any pain with either one?
Mm-mm.
Okay. Yeah, you can feel. Just restriction. Okay. So I'm gonna have you lay on your left side facing me. Might be some popping and cracking. We're gonna adjust the posterior hip there. Call that a PI ilium. This you will, I'm sure, had. Good. And go on your back.
That was awesome.
And then this is basically a mobilization. It's not real specific. We're just releasing tension or looking to. Good. Good. Great. Okay, and come on up.
That was awesome. It cracked so many times.
Yeah. So let's give it a couple days. Let's check you beginning of next week.
Okay.
See where we're at. Let me know of anything you notice, good, bad, or otherwise. Sometimes you notice you're sleeping different. Mm-hmm. Some people notice they're eliminating, whatever. Mm-hmm. Yeah, we'll just go from there and we'll get you fixed up, Adrian.
Okay.